Assalamu alaikum, everyone, and a very good morning. Thank you to everyone who is joining us today and sharing your Sunday morning with us. I am Dr. Samina Noor. I am a family physician working in Calgary and a clinical lecturer at the Department of Family Medicine, University of Calgary. Joining me today in hosting this program is my fellow moderator, Dr. Muzaffar Siddiqui.
Thank you, Dr. Noor. And good morning to one and all. And thank you to all of you for spending your Sunday morning with us. As mentioned, my name is Muzaffar Siddiqui. And as the background on my video will suggest to those of you familiar with the hiking terrain around central and northern Alberta, I am the Central Alberta member of the family here today, being a neurologist at the University of Alberta and Grey Nuns Hospital here in Edmonton. Good morning once again and welcome.
Before we get started today, I would like to quickly address a few housekeeping items. All participants are to please remain muted. If you have any content-related questions, please submit them using the Q&A or the chat box that must be located at the bottom of your Zoom screen. We will address your questions at the end of each presentation. Please note that we are also recording this session and will post the video on APNA Alberta chapter social media platforms. We are also live on Facebook page of APNA Alberta chapter. For those of you who know and those who don't, APNA stands for Association of Physicians of Pakistani Descent of North America. APNA was founded on October 30th, 1976, and has been in operation successfully for the past 45 years. It is one of the largest nonprofit medical organizations in North America. Interestingly, the first Canadian chapter of APNA was established in 2009. And 10 years later to that, APNA Alberta chapter was inaugurated in 2019. Not too long ago, but I would say that the strong leadership of this chapter has been working tirelessly to ensure that we realize its potential. And so in general, the association as a whole continues to grow even stronger. APNA Alberta has been successfully organizing Healthcare Day webinars over the past 2 years since establishment in 2019. And we at APNA Alberta are very delighted to welcome you all to the third virtual APNA Healthcare Day today. To begin our program, I would kindly request Dr. Tariq Awan to please say a few words. Dr. Tariq Awan has been a family physician in Calgary, Alberta since 2004. He is a fellow with the College of Family Physicians of Canada. He is a teacher, a preceptor at the Cummings School of Medicine, University of Calgary. He is the founding president of APNA Alberta chapter. He is also a co-chair of APNA National Health Day, and he serves on multiple committees in APNA. He has also been chairing for Shaukat Khanum Memorial Hospital Calgary team for the last 3 years. He is a father of 2 teenage boys, and in his free time, he loves playing various sports. Please join me in welcoming Dr. Tariq Awan to please say a few words.
Thank you so much, Dr. Samina, for a kind introduction. Assalamu alaikum and good morning, everyone. It's an honor and privilege to welcome you all on this Sunday morning on behalf of APNA Alberta chapter, especially Dr. Rizwan Khalid, APNA President 2021, who has kindly taken the time from his very busy schedule to join us today. APNA National Healthcare Day has been traditionally organized across North America since 2012. As we know, for APNA Alberta chapter, this is our third program. Our plan was to have this plan and program in person. However, due to COVID restrictions, we could not capitalize it. We are sincerely hoping that this is our last Zoom program, as all of us and public in general are COVID fatigued. Apna National Healthcare Day in USA focuses on public who have no healthcare coverage. However, in Canada, as everyone has the access for the health coverage, so our focus has been on education and awareness for healthcare professionals and public well-being. Taking this opportunity, greatly appreciating all involved to put this program together. Dr. Mukarram Zaidi will be highlighting this aspect more in detail in his note later in the program. Looking forward to an informative session, and I hope everyone will enjoy it and get benefit from it. Once again, a warm welcome to all of you and have a nice day.
Thank you, Dr. Awan. You know, the Apna Alberta chapter can certainly boast of fostering a very inclusive, engaging, and democratic atmosphere. And this really is, notwithstanding this, this really is a testimony to the supportive leadership of yourself, Dr. Awan. So thank you for your leadership, and thank you for your words. And on that note, from one realm of supportive leadership to another, let me introduce Dr. Rizwan Khalid. Dr. Khalid is the acting president of UPNA and has been active in various leadership roles in the organization for the past 12 years. Additionally, he is a cardiologist and member of the academic faculty at the University of Rochester, New York, and a proud father of two. Welcome, Dr. Khalid.
Assalamu alaikum. Assalamu alaikum, ladies and gentlemen. Thank you very much for the very kind introduction, Dr. Siddiqui. And, you know, now I actually have 3 kids now, mashallah. So we have an addition of another in the last 18 months. So first of all, a very warm welcome to all the members that are participating in this National Healthcare Day in Alberta. We greatly appreciate the participation of Alberta chapter in our National Healthcare Day. And as Dr. Tariq Awan mentioned, National Healthcare Day, the thought behind that was to do free clinics in various component societies of APNA that provide free care to the patient population that is otherwise underserved and do not have proper access to healthcare. But you know, in Canada, since the healthcare system is different, with almost everybody having access to healthcare, it has been more of an educational opportunity that Alberta Health Chapter has been doing for the last 3 years. So I want to thank the APNA Alberta Health Day team of 2021, Drs. Saad Yassin, Dr. Samina Noor, Dr. Muzaffar Siddiqui, Dr. Amir Aslam, Dr. Mukarram Zaidi, Dr. Khurshid Khan, Dr. Samina Bajwa. I would also like to thank the APNA Alberta Board of Directors under the leadership of Dr. Tariq Awan, who has played a very pivotal role in Central APNA as well, and also chairs co-chairs the committee that we have for National Healthcare Day with Dr. Ehtisham Haq. Dr. Tariq Awan and many other members of Alberta chapter also play a very significant role in various committees within APNA. I would also like to highlight the role that APNA Alberta has done by leading the effort for membership renewal and membership expansion in Western Canada. As Dr. Noor mentioned, that the first chapter that was made in Canada was way back in 2009, and there was not much of an activity in Canada afterwards. We're very appreciative of the effort of the leadership of Alberta chapter and Dr. Tariq Khawan to have created not just a very vibrant Alberta chapter that has actually won within the last 2 years awards from Central UPNA for being one of the best chapters in all of UPNA, and that is a testament to the work that the leadership has done, but particularly trying to increase the membership and creating new chapters in Western Canada. The Saskatchewan chapter was made earlier the year. Very thankful to Dr. Najma Jamil for her leadership in that regard. We're looking forward to other chapters, if possible, in Manitoba and British Columbia. And also very eagerly, Central UPNA awaits the Western Canadian retreat hosted by Alberta chapter next year, and looking forward to Alberta's hospitality. With that, I would again thank from my executive committee, the executive committee and board of directors of UPNA Alberta chapter, the national healthcare team, many of them who are here, the moderators, the panelists, and looking forward to an excellent meeting. Thank you, and Khuda Hafiz.
Thank you, Dr. Khalid, for your message of ongoing support. Now, the topics of our webinar today acknowledge that despite all the collective efforts, struggles, and milestones that we as Albertans have shared in the past year, that the pandemic still looms preeminently in many spheres of our lives. And thus the topics that we have chosen today highlight the fact that unfortunately we still very much live in a reality and in a world in which the pandemic prefigures. We've all had meaningful experiences that remain part of our families, our colleagues and friends' formative experiences this past year and a half, and many of which may have informed us and brought us here today. With the audience's permission, I'd like to share intermittently some of my own experiences as a physician and family member that have occurred over these past few months. I'd like to refer to this as my COVID diary, documenting some of my experiences as a stroke neurologist and as a member of a household affected like so many others. Please bear with me all. I wonder if you can all see my COVID diary now.
Yes, we can, Dr. Siddiqui.
All right. Well, I'm going to start by sharing with you a CT scan of a patient of mine. This is a gentleman who's a 40-something young father of one who experienced a very large right hemispheric stroke. And I can draw your attention in the left-hand corner of this image The blurry dark area interspersed with islands of brighter coloration represent this evolving large, bright hemispheric stroke with some degree of hemorrhagic conversion of his stroke. This patient's handicap was dramatically apparent in the early phases of his illness as a very severe paralysis of his whole left side and a syndrome that some of our healthcare professionals who join us here today will be familiar with, known as hemi-neglect, in which he demonstrated a lack of awareness of his illness, his deficits, and indeed even the left side of his body. A syndrome dramatically demonstrating that the eye truly only sees what the mind knows. Fortunately, as a testimony to the vigor of his youth and the remarkable capacity for regeneration of a young brain, he progressed along the rehabilitative journey to developing at first awareness, enough to participate, and thereafter enough to make meaningful recovery and return to the community. Along the way, I was often informed by medical staff, nursing staff, and rehabilitative staff on how problematic and his quote unquote personality was, and how he would attempt to take control of his therapy, his medications, his appointments with family members, and other aspects of his career, of his care, in a very authoritative and sometimes quite intimidating fashion. I counseled my colleagues to be sensitive to the fact that this gentleman, amongst other things, was struggling with a dramatic loss of autonomy, a severe sense of disempowerment, at having no longer, facing the prospect of no longer being the breadwinner and the demonstrable head of his household, and that these episodes of acting out ought to be interpreted in terms of the psychodynamics of an attempt to reinsert an element of control and autonomy in his life. The second patient in my diary, who I saw also over the course of this pandemic recently, is a young gentleman in his 20s who came to our emergency room in order to have a small laceration on his lips stitched up, incurred in an unidentified trauma for which the patient was not forthcoming. He returned a few days later, however, due to a very persistent headache. This is his CT scan. The healthcare providers, again, in amongst us, will recognize that what we see is an area of hemorrhage in his left frontal and temporal areas, very close to the regions of the skull that are characteristic of traumatic brain injury. This represents a cerebral contusion and intracerebral hemorrhage. Very significant degree of injury in an individual who was not able to recollect, reportedly, or perhaps volunteer what the inciting trauma might be. Consequently, we also had to make allowance for the possibility that there was an unwitnessed seizure, which may have in fact been the inciting event, and given the potential for an intracerebral hemorrhage to elicit epileptic events, we did start him on treatment and conferred him a medical leave of absence from work and a counsel to remain diligently abstinent of driving. I received a call from him urgently within the month, indicating to him that he felt that he could manage his headache, that he felt quote unquote fine, and that he was anxious to return back to work, as notwithstanding his medical leave of absence, his paycheck was critical or crucial in supporting his mother and his family, both who were living abroad. The tenor of the interaction with him had shifted from being appreciative and docile to being confrontational. And our approach in clinic was to introduce him to resources by way of the social worker associated with our clinic, and also to contact the Glenrose Rehabilitation Hospital, where an appointment had been pending, to urgently expedite his multidisciplinary assessment to facilitate perhaps an early supervised return to work. In recognizing that we were listening to his concerns and the realities of the consequences and of the loss of income in his life, along with the potential sense of disempowerment once again, he then reestablished a therapeutic alliance with us and was able to comply on remaining abstinent of driving while we expedited his return to work. Now, far be it from me to oversimplify the complexities of what we as a society are struggling with in the wake of the pandemic, but I can't help but see important parallels in these interactions at the bedside and what we as a community have been struggling with our collective sense of disempowerment, a need to exert some sense or understanding, even if it means imposing a worldview which might be fueled by the echo chambers of our choice, in order to exert a degree of control or apparent control in an environment where we collectively all feel very helpless and disempowered. And when you couple this with the very real financial ramifications that we're all struggling with, one can't help but feel that approaching this as a community can be informed by some of the lessons that we learn as physicians at the bedside. Finally, I'd like to share with you this CT scan from a young woman in her 30s who was airlifted to us from Northern Alberta after a dramatic decrease in her level of consciousness, about 1 week after she suffered what appeared to be the most superficial symptoms of COVID-19, verified as being due to the Delta variant. What we see here are the tragic and dramatic thrombotic complications of the illness, where she incurred at that time a life-threatening and subsequently a life-altering cerebrovascular event. These experiences make this recent interaction in my COVID diary particularly poignant. I do have the privilege of also taking a heart and stroke clinic in rural Alberta, which currently, due to the dynamics of the pandemic, we are running virtually. And I was recently interviewing a patient who'd done very well in recovery from a minor stroke. However, upon concluding, postponed the appointment in order to request a vaccination exemption. It was my attempt to try to inform him of what are the bona fide bases for vaccine exemption, as very nicely tabulated in the Scientific Advisory Group brief for medical exemptions, which are a resource that many of us ought to avail of in our interactions. And despite the best of my efforts, some of the representative statements that denote the tenor of the conversation were evident in his immediate response with, "I understand that you have your marching orders." Or subsequently, after some attempted dialogue, "I shouldn't have to subject myself to the risk of a serious complication and then acquire the complication in order to qualify for not having to take the vaccine." Now, he was an alternate tradesman. I've modified things for the sake of confidentiality, but his statement was akin to, "I'm a painter, and even I know that," referring to the talking points that are perpetuated. But what about Israel? It's the most vaccinated country in the world and currently has the most cases in the world. And my not choosing to vaccinate myself may put me at risk, but isn't affecting anyone else. a statement that had a peculiar tragedy given that our ICUs here in Alberta were at that time functioning at 175%. My nursing staff was also remotely involved in the televideo encounter. And perhaps somewhere around halfway through this hour-long prolongation of our appointment, I was sent this particular text from one of the nursing staff. I share it not merely to try to extol some sort of virtue on our behalf, but rather to share what she shared with me after the encounter was done, in which she said, Dr. Siddiqui, you know, we're the ones here in Emerge in the periphery who have to intubate these patients and send them onward into the city. And, you know, they're often people we know, friends, neighbors, or family. And consequently, even though we're aware of what convictions they may have about the vaccine, it still doesn't make it any easier to see your neighbor in distress. And so really, I'd like to share that heartfelt statement as really an open-ended question for both our speakers as well as our participants and viewers here this afternoon. Indeed, our first speaker, Dr. Chuck, I believe is well equipped to address some of these issues in his subsequent talk this afternoon rather.
Thank you. Thank you so much, Dr. Siddiqui, for sharing your experiences. I am definitely overwhelmed. These are really heartwarming experiences of yours that that basically gives us a glimpse into what sort of not only mental but emotional disruptions the coronavirus pandemic has caused. I would also take this opportunity here to express my gratitude and my appreciation to all the healthcare workers, especially those who are fighting at the front lines for the time, for the dedication and the work that you guys have been putting in to helping and caring for others during these very insane times, I would say. So thank you so much for all the bravery, for all the sacrifices and the unflagging compassion. It is also really interesting, Dr. Siddiqui, that you shared this anecdote with us, because I believe many of the viewers and audience today may actually be having similar questions brewing in their minds. I would like to, I would not be wrong if I say that this year in particular, the previous year, the year 2020, is one of the years that most of us are never going to forget. During the past 2 years, the coronavirus pandemic has unfolded across the globe, creating and generating a lot of mental health crisis amongst all groups, whether healthcare related or not. It has literally wreaked havoc into everyone's life, to the point that I believe most of us are wondering, is it ever going to end? This is the question that everybody is asking these days. And at the same time, I would say, while we are inundated with a lot of information about COVID-19 and the coronavirus pandemic, we still seem to know so very little. So it basically compels us to struggle to find the truth wherever we can and however we can. Today's program, I would say, is aligned with similar efforts to try to learn and understand more about the COVID-19 pandemic. Joining us today to figure out answers to our questions are two very esteemed guest speakers who have very kindly volunteered their time to virtually join us today from the United States in sharing their expertise on the very informative and relevant topics related to the coronavirus pandemic, the COVID-19 vaccination, and overall the effects of social media during these times on our mental health. Please join me in welcoming our very first speaker today, Dr. Asfar Chak. Dr. Asfar Chak is the Chief of Infectious Disease Department at Montefiore Nyack Hospital in New York. He's also a clinical associate professor at New York Medical College. Dr. Asfar has received various honors and awards throughout his medical career. A quick review of his published research work tells me that his main focus is around the various infectious diseases. Please welcome Dr. Asfar Chak.
Assalamu alaikum.
Wa alaikum assalam.
Walaikum assalam.
I'm sorry. I'll start over. Assalamu alaikum. Thank you, Dr. Noor, for the warm welcome, and Dr. Siddiqui. It was a phenomenal presentation. And I'm also very thankful to Dr. Awan for this opportunity. So the topic that I was asked to discuss was, the fatigue that we're going through as far as COVID is concerned, in addition to the certain questions that we may have about the vaccine. I would certainly love to make this an interactive session, but just a very brief introduction about the vaccines and, what's the update about the vaccines. So if we can move on to the next slide. So in brief, there are 3 vaccines that are currently available. The first 2 vaccines being the Pfizer-BioNTech, as well as the Pfizer-BioNTech, as well as the Johnson & Johnson and Moderna vaccine. The Pfizer-BioNTech as well as the Moderna vaccine, they both work on the messenger RNA. It's a technology that has been tried and tested for a few years, probably for a decade or so, and the scientists were waiting for an opportunity where if a new virus was to come into existence, they were going to use these vaccines and see how they would act. So the research was done in a short period of time, in about 4 to 5 months, after they already had the blueprint of the vaccines. So these vaccines were deemed very safe, very effective, and then there were multiple researches and multiple studies and peer reviews done, and then they were out for release. So in brief, the Pfizer vaccine, it's stored at a lower temperature, and it is to be used almost immediately after it's brought to a room temperature. So if we can go to the next slide, please. So as we stated, it's a mRNA vaccine. Basically what that means is it teaches our cells how to make the protein, or just a piece of the protein, and then it triggers an immune response. As soon as the body is hit with the virus, this mRNA will get activated and it will go and destroy the virus. Next slide, please. The Moderna vaccine works very similar to the Pfizer vaccine. The difference is that it can be kept at a room temperature for a little bit longer period of time. Next slide. And as far as the Johnson & Johnson vaccine goes, this works a little bit differently compared to the Pfizer as well as the Moderna vaccine. So basically this works in the viral vector vaccine, uses a modified version of a different virus to deliver the important instructions to our cells. So it would give protection against the viral virus in that way. The contraindications are very minimal. We've seen very few allergic reactions to these vaccines, be it the Pfizer vaccine or the Moderna or the Johnson & Johnson. We've seen very minimal side effects to it. One of the relative contraindication will be if somebody has received monoclonal antibodies, then or a plasma convalescent therapy, then we need to wait for 90 days prior to giving this vaccine. These vaccines are considered very safe in lactating women as well as pregnant females as well. So we encourage that population to get vaccinated as well. People who have been previously received or had the COVID virus, it's very safe for them to take these vaccines as well. Next slide, please. Next slide. So now, as far as the booster vaccines go, this will be the third series of vaccines in the mRNA, i.e. the Pfizer and the Moderna, and this will be the second in the Johnson & Johnson. So the indications for Pfizer and the Moderna vaccine will be anyone over the age of 65, or anyone who's older than 18 years of age, living in a chronic care facility, or has other medical conditions, such as chronic kidney disease, underlying lung issues, underlying cardiac disease, or somebody who's over the age of 18 and is working in a high-risk settings. High-risk settings are considered any medical care facility, grocery stores, or any other places where there's there's interaction with many people. Those are considered high-risk settings. The waiting period is 6 months prior to getting the third vaccine after you have received the second. Next, please. Johnson & Johnson is a little bit simple. Anybody over the age of 18 is eligible to get it. The waiting period is 2 months instead of 6. Now, we want to discuss the vaccine hesitancy. Anywhere you go, there's still a significant portion of the population that is very hesitant about the vaccine. So I wanted to dissect it, just take one by one, some of the issues that we have heard, in the social media, in otherwise the popular media, or many of our patients who have brought up these issues. So I wanted to dissect each one of them one by one and just have a brief discussion about this. And maybe afterwards we can have a few discussing points on this as well. As Dr. had mentioned briefly prior to my presentation. So one of the first things that we always hear is the vaccines were created very quickly. So I briefly touched upon this fact. Yes, the COVID vaccine came out in the market 4 to 5 months after that quote started working on that. However, what we need to keep in mind is the blueprint of the vaccine was being worked on for many, many years, probably even a decade. They were working on the blueprint of the vaccine. They had already seen what this vaccine could do. They had already observed and studied what this vaccine could do. So as soon as this new virus came, they utilized that blueprint, and then they applied it to this virus, and they deemed it to be very safe. There are different phases that FDA has to approve prior to, or FDA has to look at prior to approving the vaccine. So all those phases were done simultaneously, and this vaccine was deemed very safe. So it's rather not created that quickly. It was still years in the making prior to approval. The second hesitancy that a lot of people have is some of the side effects that are associated with the vaccine. So pretty much everyone that I've checked with, including myself, when I took the vaccine, I did feel sick for approximately about 24 to 30 hour time period. I had myalgia, muscle aches, I had a low-grade fever, I had headaches, and I was feeling very fatigued. However, these symptoms just lasted 24 to 30 hours, and then those symptoms resolved immediately. Even though I had those side effects, I still went to work. I still had a normal work day, and I was fine. Right after the work day was over, I was completely fine. Some people are concerned about certain long-term side effects. So again, certain side effects such as neurological deficits, such as Guillain-Barré or some other effects that people can see with the vaccine. Typically, those side effects occur within the first 2 to 3 months. The quote long-term side effects occur within the first 2 to 3 months after the administration of the vaccine. This vaccine was tested for at least 6 months. They did not see any side effects. That's why the FDA was quite comfortable in approving for it, and after they had the peer reviews as well. The third point that we hear from many people is technology used to create the COVID vaccine is too new to be safe. I think we addressed that with the first point. It's new in the sense that this was the first time it was released. However, it was in the making for at least a decade or maybe more. Another point many people bring up is breakthrough cases prove that even if we get vaccinated, we still might get sick. So why even bother getting the vaccine? So I had a discussion with a patient's wife yesterday. This patient is admitted in the ICU, and they were very hesitant about the vaccine, did not receive the vaccine. Unfortunately, the patient is intubated at this point. He has a breathing tube. So the wife was still reluctant. She said, look, my sister had the vaccine and she got the virus anyway after getting the vaccine. So my response to her was, I understand that she got the virus, but was she sick enough to get hospitalized, or was she sick enough to have a breathing tube? So obviously the answer was no. This vaccine is deemed 94% effective, or these vaccines are deemed 94% effective. There's no vaccine on the planet that's going to be 100% effective. So that in itself tells you how effective it's been. Most of the other vaccines that have been in the market have been deemed anywhere from 70 to 75% effective. So this is really a high percentage. 94% effectiveness is considered really excellent. So if we can go to the next slide, please. Again, some other points that people bring up about vaccine hesitancy is infertility issues. This vaccine does not work on the germ cells. This vaccine does not work or adversely affect infertility at all. Multiple studies have shown that. I've known many people who have taken the vaccine and they have become pregnant afterwards, and they're going through a normal pregnancy at this point. Many people, including many physicians I've heard saying this, that if I had COVID, I'm immune. Why should I even bother getting the vaccine? Now, again, my response to that is we don't know how long the immunity will last. In most cases, we've seen immunity can dwindle down after a span of about 6 months. So usually if you've had the virus, it's only effective for 6 months, number one. Number two, if you had COVID, some variant of COVID, just keep in mind there are many other variants that are out at this point. As Dr. Muzaffar had mentioned, the Delta variant that he was mentioning about, yes, that is out. So if you had the COVID virus in itself, it's not going to protect you from other variants of the virus. Many people have brought up this issue about children not needing the vaccine since they do not become sick. Again, that's not true. We're seeing many cases. In fact, many of the hospitalized patients nowadays are from the pediatric population. So that's not true. We're seeing kids becoming quite ill. Kids are coming up with many other illnesses that are attributable to COVID as well. Another point that people bring up is, if I'm vaccinated, why would I need the precautions at this point? See, what we're trying to do at this point is have multiple layers of protection. Vaccine is one of the layers of protection. Another layer of protection is the mask. Social distancing is another layer of protection. So if you are protected in multiple ways, there's a low probability of this virus being transmitted and revving up again. Again, back in the day, before we had the vaccines, we were trying to do our best to socially distance and mask. And as you had seen, they were quite effective, not to the point where, it was saving people's life, but they were quite effective. Now we're just adding a second layer of protection by doing this. Another misnomer that many people have is that if I get the vaccine, I'm going to be going around shedding the virus, and therefore other people will be getting the virus. Again, not true. This is an mRNA vaccine. So what that means is you're not getting the live virus. You're not getting the virus in your body. You're just getting a technology that's going to attack the virus. So we need to keep that in mind as well. We're not giving the virus as certain live vaccines, where a small portion of the virus is injected, so we can build some antibodies, which is not the case with this mRNA technology. Thank you. So a lot of people bring up the issue about, conspiracy theorists. They bring up the issue that, look, this is a government ploy. The government is doing this so they can put a chip in me. They can monitor my every movement. They are doing this so my freedoms are going to be taken away from me. So my answer to that is, you are already walking around with a chip. So 80% of the population plus already has a chip. They're walking around with this. So the government does not need to, put another chip in you when majority of us are walking around with a chip already. There might be certain cultural issues in America. The African American population. There were many experiments that were conducted on the African American population in the last century. So there's a lot of reluctance amongst the African American population in America. However, again, this is not a vaccine that's being experimented just on the minority population. The majority population, the upper social class, they've all received the vaccine. They've always mentioned that pretty much everybody in Congress and Senate has received it. All the Army personnel have received it. Every former and current U.S. president has received it. So we want the African American population or other population to be aware of the fact that this is not being targeted just for a small population. Next slide, please. Just briefly wanted to discuss about the post-COVID syndrome, as we're going through the COVID fatigue at this point. I'm very optimistic. I think we are really on the verge of winning this battle. Unfortunately, this is a battle where all of us, all citizens, have to take their, they have to play their role. Globally, it's not just America or Canada. Everyone from everywhere in the world has to play their part in it. So I think we're winning the battle. However, I just wanted to mention a brief, just briefly about the post-COVID syndrome. There are different names given to this, such as long COVID, post-COVID syndrome, post-acute COVID syndrome, long haulers. These are all interchangeable names. And basically what they did was they did a few studies. One of the studies that they did, I believe this was in Europe, where this followed over 1,700 patients, and they had exhibited at least one of the symptoms, such as fatigue, muscle weakness, sleeping difficulties, anxiety or depression. And however, mortally severe ill patients had increased risk of pulmonary diffusion abnormalities, lung defects. Many patients had seen that as well, along with anxiety, fatigue, and weakness. Another study that was done was in Michigan, where they studied over 1,600 patients in a span of about 4 months, and they saw nearly 1 in 3 patients had died during hospitalization after 60 days of discharge. And the other patients had ongoing morbidities, including inability to return to normal activities, as well as cardiopulmonary defects as well were noted on those patients. And this confirmed that the toll that COVID was taking in many of these populations. This was mentioned by Dr. Siddiqui as well prior to this. Next slide, please. There was an Italian study that was done as well, where they continued to follow patients who were discharged, and they saw many patients with fatigue and dyspnea, or fatigue and shortness of breath, or respiratory issues after discharge as well. I'm sorry, after they had recovered from COVID. Next, please. British Medical Journal had followed nearly 50,000 people after discharge from the hospital with acute COVID. They saw nearly 14,000 were readmitted. Unfortunately, close to 6,000 had died, and there was an increased risk of organ dysfunction compared to the general population after they had been struck with the virus, COVID virus. The 2 common syndromes that currently are with long COVID are postural orthostatic tachycardic syndrome, or POTS, where we see an autonomic dysfunction where people lose control, and then their heart rate, blood pressure, blood flow, they'll have those issues. And chronic fatigue syndrome is quite common with COVID as well. People come back 6, 8, 10 months, a year later after COVID, and they have significant fatigue, sleeping abnormalities, memory issues, concentration issues. Their sleep is not refreshing. When they wake up from their sleep, they're quite fatigued and tired. And long-term symptoms were common in about 27%, more than a quarter of the population who had COVID in up to 9 months, whereas 43% of the patients over the age of 65 had these symptoms. So as the age progressed, these symptoms were seen more frequently. Up to 80% of the patient population had fatigue as well with COVID. So this chart, you could see a comparison where you could see the percentage of people who have acute COVID, what are the most common symptoms, and they're pretty much lined up. The same symptoms are seen post-COVID as well, most common being fatigue and dyspnea, along with joint pain and cough. So you could see they're almost lined up. So whatever patients see in acute COVID syndrome, they will see in post-COVID syndrome as well. On the bright side, the US government has allocated $1.5 billion in assistance to study post-COVID syndrome. This study is being conducted at Johns Hopkins University along with Harvard, and we're hoping a lot will come out of it, hopefully in the next 2 to 3 years. So please stay tuned, and we'll hopefully update you about some more bright news that we might get. So in the end, we just want to thank especially UP Alberta and all the people who have been on the forefront in the last almost 2 years of this virus. And again, I want to thank you very much for this opportunity to be with you today. Thank you.
Thank you ever so much, Dr. Chuck. If it weren't for the format of the webinar, I think you really would be privy to a resounding roar of applause, if not a very appreciative standing ovation. It was really, really an extremely informative, empowering presentation. I think for the concerned member of the general public, and indeed certainly for the healthcare provider at various levels in the front line who struggle with attempting to continue to inform and patiently inform and reassure our patients to the hopeful and anticipated benefit of everyone. And may I add that not only is the content so informative, but your erudite, gentle, and reassuring delivery is, I think, something that many of us would attempt to emulate at the bedside as well.
Thank you very much.
Particularly given how confrontational some of these interactions have been and can be. There are a few questions that I think come to our collective minds, and the rose is pinned on me right now, so I have the privilege of perhaps communicating these questions to you. I was very appreciative, really, of some of the common talking points surrounding vaccine hesitancy that you dissected. I just wanted to ask or request if you could clarify that 94% number, as it's often seized upon in the social media that proves to be one of the echo chambers of our vaccine hesitant patient population in not really discriminating between case recurrence efficacy percentages versus efficacy surrounding severe illness and hospitalization. Indeed, in the anecdote I even shared, the cherry-picked statements from the oft referred to Israeli data as well also, I think, confuses just those two issues. So I'm wondering, would you be kind enough to kind of clarify that distinction for us, please?
Thank you. And thank you so much for the kind words, Dr. Siddiqui, again. Yes, so the 94% number represents decrease in mortality and morbidity. So in essence, what that means is, I believe you had mentioned that the ICUs are running at 175% capacity. So we were in a similar situation last year. I always give this example. When we had the COVID peak, I represent two small community-based hospitals in the New York area, in the New York metropolitan area. Both of them have a capacity of about 225 to 230 patients each. When we had the peak of COVID, our numbers were about 210 to 220 COVID patients in each hospital. Our ICU capacity is about 24 in each hospital. I think 27 in one and 24 in the other. Our census was in the 50s at that time. Right now, our numbers, COVID numbers, are down to 5 in each hospital, and our ICU numbers are between 1 and 2 in each hospital. So it's really attributable to the vaccine. Ever since the vaccine came out, this is how the numbers have dwindled down. So again, I will just compare this with certain other vaccines. So people take flu vaccines. Before the advent of the flu vaccine, mortality was quite high. Now, we still see some unfortunate people who don't make it, after they contract the influenza virus. However, the mortality has gone down significantly. So we should just keep that in mind with the COVID vaccine. We're still seeing an occasional death. We're still seeing occasional people who are ending up on a ventilator. Unfortunately, we do have one case right now where the individual was vaccinated. But again, it's nothing like what we had, last year. So I think that's what we should keep in mind, and we should encourage to tell our patients as well.
Thank you. That's very useful information. And to summarize, as we do actually have members of the the interested general public who are present this afternoon, to clarify the distinction between simply case numbers, people may very well, even if they do get the illness while vaccinated, what the data overwhelmingly shows that even if you do get ill, the likelihood of that progressing to severe illness, requiring hospitalization or admission to the intensive care unit, or even culminating in fatality, is decreased by a magnitude of anywhere from 94 to 97%. So that's very important to make the distinction when you hear people who don't discriminate in their presentation of the data. Thank you, Dr. Chuck. I see a question that has come in again from one of our audience, and I think it's a good question, and one I think that you've alluded to in your presentation. In terms of the early phases of the pandemic and our evolving inclusion, a lot of that I think had to do with the strategic logistics of targeting the most vulnerable members of our population, as well as the nature in which the trials targeted our most vulnerable members within the adult population, and how the data surrounding its safety in children was forthcoming, and that there's really nothing really conspiratorial about that. Secondly, how the variant has changed the natural history of the illness in younger patients as well, suggesting a need to be both vigilant in terms of social distancing precautions, but even suggesting a role for vaccination in younger patients below age 18 as well. Now, given this evolving landscape, and to reassure patients in the potential patients in the general public who see this shifting landscape, that this is not a consequence of anything conspiratorial. Can you speak somewhat again to that, to our evolving knowledge and application of vaccines in patients less than age 18?
Sure, thank you. Thank you for this question. Yeah, so I think that in itself is an answer to any conspiratorial theories that might be out there, i.e., they did not hastily just, release the vaccines. They're studying it. They're constantly studying it. They're getting a better pool of patients. They're checking if there's any short and long-term side effects. They're checking the dosages, if it's appropriate to give a certain dosage to the pediatric population or patients under the age of 18 or 12 or 5. So they're studying that constantly. Once they feel comfortable, that's when they release the data. And then when the data is released, then there are more studies. FDA panel will sit down. They will do what we call a peer review. They would look at the study very in an unbiased way, and then and only then they will feel comfortable in releasing the vaccine. So I think this is an answer to any potential conspiratorial theories that might be out there that, I haven't, frequently you hear people saying that, I haven't studied about the vaccine, so I would like to get that studied first. Behind the scenes, those are all the studies that are being done. Before it was released for the adults, and something that you alluded to, Dr. Siddiqui, was, this vaccine was studied in the adult population, and the subject there were about 70,000 subjects that it was studied for, 70,000 people. And they examined it very carefully. They looked at the data, and then they released it for more reviews to the FDA. Then they went to the next population. So as you stated, there was a certain set of patient population that was unfortunately more vulnerable in the initial stages. So they just wanted to make sure logistically they could get through that patient population and studied that population first and foremost. And now they're studying, and now they have felt very safe for the patient population that's between the ages of 5 to 12. And FDA studied it in an unbiased way, and they have recommended usage of the vaccine in that population as well. I hope that answers the question somewhat.
Oh, very much so. Thank you. And then perhaps if you wouldn't mind just reiterating how the natural history of the illness has changed with the emergence of the variants in younger patients as well.
Okay, great question. So pretty much every virus, especially the coronavirus. So just to let you know, coronavirus, there are certain other viruses that come in this category as well. The flu virus comes in the coronavirus category. COVID-19 virus is also in the coronavirus category. The H1N1 virus that we had approximately a decade ago also comes in that category. These viruses have a tendency of mutating. So they're always looking to stay ahead. And what we typically do is, if we control the virus right at the onset, the virus does not get to the point where it would mutate. It just would lose that ability to mutate. Even if it mutates, it's going to be at a very small level. It's not going to be at a global scale, at a pandemic scale. So yes, that's one of the ways that we stay ahead of the virus, by giving the vaccine and trying to destroy the virus at the very initial stages, and let it not have the ability to mutate beyond a certain point.
Thank you. That's a really important clarification as to the incentive and sort of the shared responsibility that we have, and really how that personal decision does have ramifications that go beyond ourselves. I'm going to, there's a lot of interesting questions that are emerging in the audience. I'm going to end with this last question before we transition onward to our additional speakers who we're looking forward to welcoming as well. Dr. Chuck, with my background in neurology, I'll share an interesting anecdote. The now sort of integral investigation we have at the bedside that has really challenged so many of our lofty bedside clinical axioms in terms of disease recognition or discrimination, which is essentially MRI imaging. Really, imaging has really informed a lot of the, and really helped us, if you will, dismantle a lot of the sacred cows that traditionally were brought to the bedside. It's such an integral part of our investigations in neurology. And yet, of course, at around the time that it was the creators and the physicists who were involved were nominated for the Nobel Prize, the technology was referred to as nuclear magnetic resonance imaging. And interestingly, that N part has been dropped from hospitals the world over, because the simple presence of the term nuclear engendered so much anxiety about the prospect of this being mutagenic, radiation, etc., which of course it is not, but it was a perceptual issue. And similarly, you see, you hear it perpetuated in popular media, and certainly even at the bedside, how the mRNA viruses, the simple inclusion of the genetic terminology or the nucleic acid terminology in its designation seems to confer this popularization of the notion that it's some sort of genetic engineering occurring in our patients, without really referencing the fact that the mRNA is biologically a very volatile substance that the cell breaks down almost immediately after engendering the immune response. So can you speak a little about those unfounded anxieties that seem to be perpetuated by merely the terminology of the vaccine?
Great question, Dr. Siddiqui. This is really, and I meant to bring that up. I'm not sure why accidentally I omitted that from one of the slides. So right, the mRNA vaccine will only activate when the virus hits the body. It has fortunately no effects on the DNA, which is how we're composed as human beings. A bunch of DNAs coming together. It's absolutely none whatsoever effect on the DNA of us. It strictly activates the mRNA only when the virus comes in, and it would only stay to that level. It does not alter the DNA. Multiple studies have shown that. Multiple studies have debunked the fact that there's any cross reaction between a DNA and an RNA. Those are two different species, if you will. You know what I mean? And like I said, it only gets activated when the virus will hit the body. It does not get activated otherwise. So it has no effect whatsoever on the DNA of our composition.
Thank you. And forgive me for reneging on my province, but I think there is just one more group of questions that you could help address, and that is surrounding sort of the emerging acute treatments around COVID. We've seen some that have been verified and found to be meaningful in terms of simple treatments like the dexamethasone. Now there's the experience we had with the SSRI, as well as the antiviral treatment itself. So can you speak a little bit to, for want of a better word, sort of acute and potentially disease-modifying treatments as well for COVID?
Sure, of course.
That actually have a basis and promise, as opposed to the popular notions that really don't have a basis.
Right. Sure. So when the virus came out last year, typically there's a feeling that most of the viruses, steroids would give an environment where these viruses can flourish a little bit more. So the initial recommendation was not to take any steroids for the treatment of this virus. However, when more studies were conducted on that, people who had significant pulmonary involvement were seeing benefited from a certain dose of the steroids. So at that point, we had changed our protocols. So only people who were hypoxic, had low oxygen saturation, it was recommended that we give steroids to them. There are newer studies that are recommending maybe we should limit the usage on them. As far as the treatment is concerned, there's a medication that Merck Pharmaceuticals is working on, and so far it has very promising results. The FDA will be studying it, and I think in the next month or two, we will find out if it's safe, and then it may be deemed beneficial to take that as well. Was that the gist of your question, or was there a second part to the question as well, Dr. Siddiqui?
No, that was it. And that particular pill, would you just introduce our viewership to its mechanism of action, the one that's on the horizon?
So I will confess, I have not studied it. I typically I'll be very honest with you. There's been so much to keep up with COVID.
Yes.
Once the FDA releases it, then I study it after that. So,
Very well. Very well.
But I have not studied it as of yet. Yes.
No, not at all. This is, of course, contrasted by popularly cited chloroquine and ivermectin treatments, which people seem to be flocking around as alternative treatments, and some people find convenient to champion as being representative of conspiratorial notions of what the establishment offers versus what is out there.
If I can just add one sentence to that. So hydroxychloroquine was promoted, as you remember, last year by many political leaders and many I think many people who are not even in the medical field. It was promoted quite significantly last year. And we had a lot of pressure from the families, which, by the way, we still do get that, where patients who are coming in critically ill, unvaccinated, families are demanding to give ivermectin or hydroxychloroquine. Interestingly enough, we did a study last year in our hospital, and what we found was hydroxychloroquine was a cause of increased mortality in patients who were COVID positive. There are more studies that are going to come out from bigger institutions as well, on the same, along the same lines. So, unfortunately, we're living in an era where anything can be stated by somebody, and if they have the loudspeaker, it just their voice becomes more loud. But unfortunately, there's no medical basis. There's no scientific basis for that. We try to do things after scientifically they've shown to be effective. Once they're studied appropriately, once they are examined appropriately, and then I gave you the whole scenario after a 70,000 pool of people where this vaccine was studied. Then it was submitted to a group or panel of experts, and then they studied it even further. And then they had certain questions. They brought up those questions, and once they thought that it was safe, then it was released right after that. As opposed to, if you see, when it comes to things like ivermectin or hydroxychloroquine, somebody in the social media or YouTube or Facebook or whatever the social media does exist out there would say that, we have seen a lower case of COVID in one part of Africa that has used ivermectin. So therefore, it has to be very effective. Again, no scientific basis for that. This was just a wild theory, and it caught fire, and people ran with that. So I think we just need to. I encourage many of my patients. I tell them that many of my patients will come up to me and say that, look, I was doing some research on the internet and I found this, that, and the other. And I know most of you physicians will not recommend us to do this research. I say quite the contrary. I said, that's fine. I encourage my patients to do research from the internet. However, just make sure it's a legitimate medical resource that you're using. It's not somebody's personal blog. It's not somebody's one-time experience, or it's not somebody, who may have a political agenda who's presenting this. As long as it's a legitimate medical resource, I encourage my patients to use it. So I think we should just be cognizant about that as well.
I think that's a nice pragmatic and compassionate note, I think, to end on here, recognizing once again that perhaps one of the factors that influences the proliferation of alternate narratives is really that shared desire to try to seek some form of autonomy and empowerment in what has been a very distressing and disorienting phase in our collective history right now. May I reiterate my thanks to Dr. Chuck on behalf of all the viewership here today, and certainly amongst the panelists.
Thank you. Thank you very much.
Thank you so much, Dr. Chuck, for such an engaging and relevant, timely presentation. I think we all learned a lot today, and thank you for debunking a lot of myths for our audience today as well. Before we move on to our next speaker for today's program, on behalf of Aetna Alberta, would like to thank our sponsors for today's program, which is Mayfair Diagnostics. Thank you for sponsoring our educational event today. We have with us a representative from Mayfair Diagnostics, Ms. Jennifer Jasper. Ms. Jasper has been with Mayfair Diagnostics since 2016 and has been engaged in physician communications for over the past 15 years in diagnostic imaging. She has her certification in marketing from the University of Calgary. Patient care and working with physicians in the community is her true passion. Jennifer is also an avid traveler, independent mother of 2 girls, and enjoys experiencing new cultures and adventures along the way. Ms. Jasper, thank you for joining us today. Sorry, you are muted. Ms. Jennifer, we are unable to hear you, sorry.
Try the toolbar on the microphone icon. In the lower left-hand corner. Should appear if your cursor is moved to the lower left-hand corner of your screen. Does that work? No. Tech support. Is there anything that we can do to help Ms. Jasper out?
Ms. Jasper, if you can type in the chat box, I can read it out for you, if that works.
We don't have anything on the Zoom side. I think this is probably the audio connection is in Miss Jennifer's computer, which is causing the issue.
Ms. Jennifer is thanking for allowing Mayfair Diagnostics to sponsor this educational event today. And she found it very informative and engaging, and she's expressing her apologies for not being able to join with her audio. Well, Ms. Jasper, it was a pleasure definitely having you here. And we from Alberta, Aetna Alberta team would like to thank you for, again, for sponsoring our educational event today. Ms. Jasper is open to any questions from the audience, if we have any. Ms. Jasper, I don't see any particular questions. Sorry, there is actually a question from one of our fellow members here. How has Mayfair Diagnostics modified its practice to ensure continuity of care during the pandemic? Ms. Jasper is communicating that Mayfair Diagnostics have strong safety measures in practice at Mayfair Diagnostics. And at the beginning of pandemic, they closed all of their locations except 4 to kind of contain the spread of the coronavirus infection. Well, thank you, Ms. Jasper, for joining us today. Unfortunately, we weren't able to hear from you, but we really appreciate Mayfair Diagnostics supporting us and sponsoring our event. Thank you so much.
Indeed. Thank you, Ms. Jasper. We appreciate your support and your participation as well in the webinar this afternoon. Well, at this juncture, Dr. Noor, I'm wondering if it might be appropriate for me to share another page from my diary.
I am eager to hear your experiences, Dr. Siddiqui, but I will also be a little bit of mindful of the time. So I mean, if you can literally, tell us about your experiences in a very brief or short version, I will really appreciate that.
All right, let's see what we can do here. Can everybody see this early page of the diary?
Yeah, nice and clear.
Well, I'm going to offer you all a little bit of a retrospective now, actually going back to the early days of the pandemic, in the pre-vaccine phases of the early pandemic. We've talked a little bit about how this might have influenced our professional experiences. It has, of course, affected us all personally as well. And in my circumstances, early in the pandemic, my mother-in-law did get quite ill in Ontario. Indeed, also suffered a minor stroke. And in attempting to become involved in mediating her care closer to home, I discussed it those days with one of my colleagues who was on the provincial steering committee for COVID, the prospect of my travel to see her. He mentioned to me in a very forthcoming manner, he was not comfortable me traveling, but mentioned half in jest that I suppose I could always drive it. And indeed, I took him at his word, and by golly, that's what I did. And what you'll see are various snapshots of the journey along the Trans-Canada Highway, not just highlighting the beauty of some of the sites that inspired our famous Group of Seven, but also a few snapshots highlighting how the pandemic was affecting both our microeconomy and our tourist industry. This is you can see here in the upper right-hand corner, a roadside food truck offering fresh fish from Lake Superior. And you can see its sanitizing station as well as its social distancing protocols. You can also see a picture of the lobby at the Fairmont in Winnipeg, which is eerily abandoned. So it's been mentioned really apocryphically, a reference about how far and how fast can pandemics spread. Well, in antiquity, as far as the fastest horse would travel. And of course, now the fastest plane. But how do we address these metaphors when they become relevant to the spread of information, or rather misinformation on the information superhighway? I think to help us wrestle with the realities of social media and how they have helped us negotiate the pandemic as well as perhaps adversely affected us, we're going to entreat upon actually our next speaker, who is amply equipped and informed to help us negotiate some of those questions. I'd like to take the opportunity to introduce our next speaker, Dr. Zeeshan. Dr. Mohammed Zeeshan will hopefully be addressing some of the questions we have in this regard. And he's a clinical assistant professor of psychiatry at Rutgers, New Jersey Medical School. He completed his fellowship in child and adolescent psychiatry at Harvard Medical School and has received numerous regional, national, and international awards for academic excellence, teaching, and leadership from the American Psychiatry Association, the American Academy of Child and Adolescent Psychiatry, the Association of Directors of Psychiatry Residency Training, and the Nishter Alumni of North America. He's presented at many regional and national conferences and published articles and co-authored book chapters in the field of psychiatry. Teaching is his professed passion, and he's actively involved in teaching medical students, residents, fellows in the US as well as in Pakistan. Please join me in welcoming Dr. Zishan.
Thank you so much, Dr. Siddiqui. Really appreciate the invitation. Let me just share my screen. So I feel honored. I'm really grateful for Apna Alberta chapter for giving me this opportunity, and also especially Dr. Tariq Awan and all the organizers. So thank you so much. Really happy to be here. So so let's talk about, because the social media, COVID, especially teenager and children. Why there is so much increase in use of social media. Is it addictive? Why is it addictive? What are common harmful effects, and what parents do? Because I think the key is a lot of people talk about what is the problem, what is causing it. But today I will try to focus some key and practical tips that can help parents to help their teenagers with use of social media. So a couple of things that either this is addictive or non-addictive. So use of social media or screen, it activate the same pathway that are being activated with the substance use like cocaine, marijuana. And that's why, it may not be surprising for you that, the teenagers and even adults, who see this kind of behavior, when we are, using excessive social media, there is changes in emotional state. When we see, some good comment, we feel good. When we see someone using bad comments, we get more angry, more irritable. And there is always this increased need to check and scroll through social media. Like, for example, you have 5-10 minutes, you said, okay, let me just check on my Facebook, let me check my Instagram, and the next thing you realize is more than an hour, and you are just sitting in the same position with the same posture, and an hour passed. So just keep scrolling the social media, keep looking into more posts. So what we call it a tolerance. And then also getting mad, upset, fighting, panicky. How many times you may have realized that you just thought that you don't have your phone in your pocket, and then your heart start racing, you start having sweating, sometimes shaking. And also you have seen in kids, if they are watching on iPad, and if you take it away, the reaction is so much strong and intense, both physically and emotionally, to the point that sometimes it can lead to some safety concerns. Like I remember one of my patient, the mom had to call the police because she has the teenager got so physically aggressive when the mothers take the Nintendo and the PlayStation. And you also seen, many times parents try to set the limit maybe for 2 days, 3 days, and the moment they gave up, or the child used so many the emotional techniques to get it back, and the moment the child get it back, the devices, they even start using more and more. It's just like if you have been have some abstinence from smoking drugs, and then once you start it, you just go back to the same high dose that you were using before stopping it. And it's very funny, sometimes we also feel that even that something is vibrating in our pocket, even though we don't have the phone or devices in our with us. So then why the teenagers? So because my goal was mostly on parenting and teenagers. So why that? So one thing, so this is addictive. It create the same pathway that is being stimulated by those substance users. Then why the teenagers? Because that is definitely a huge nightmares for parents, when they get into this verbal and physical altercation, when they try to set limits for social media. And the reason I want to help parents understand what is going on in teenage brain, why they are more vulnerable, and why they are been on social media, Instagram, TikTok, YikChak for hours, especially during COVID, due to multiple reasons. So Erikson, he's a psychologist, a very well-known psychologist, who divided human, human development into 8 stages. And the stage that the teenagers, Dr. Erickson called it identity versus role confusion. And what is happening in the teenager in this age group, like their brain is always thinking about, what careers do I want to choose, who do I believe with, what should I wear today, who should I hang with. And they want to basically, normally they are trying to form their identity. That's why they want to explore more independence. Many times, I'm a child psychiatrist. I'm an infant, child, and adult psychiatrist. I have my private practice in Princeton area. I do teaching in Rutgers. And many times parents come, they said, oh, my kid was so well behaved, when in middle school and elementary school, and I don't know what happened. The moment he, she, or they went to the high school, it seems like, they are different. They are, sometimes parents call it, they seem like they are strangers. They don't talk to us. They try to spend more time in their room. They talk their friends for hours. But the moment they have to talk to their parents, is just like a big chore to them. So why? Because it's not that they are bad parents. It's because they are going through this normal developmental phase where they are the teenagers are trying to, explore their independence. They are trying to identify different version of themselves. Sometimes they try to have a different hairstyle, other different, hair color, different dress style, because they are exploring. And the other thing with the teenage brain is it's also the test limit. And they want to make their own choices, and especially, especially in context of our South Asian parents, I have seen, this tussle between parents and teenagers, because they feel like they are losing control on their teenagers, and because they try to set limits, they try to try to, not like there are healthier way, to help teenagers to to help them to form their identity, but definitely as a parent we also want to help our teenager what is right and wrong. But the way a lot of especially in our South Asian, I have seen who are doing it, try to control it, try to not listen to our teenager, but try to, you have to do this, this is the right way, you cannot do this, and that is causing a lot of disconnection between teenagers and parents. And the other part, so one, their teenage brain is in the identity and versus role confusion. The second thing, the dopamine, the pleasure, the chemical that gives pleasure, the level of dopamine is lower in teenage brain as compared to adult brain. So what does it mean? So for example, I'm giving a presentation today, so my dopamine level is going high, I'm feeling happy. Teenager, they don't get happiness by giving presentation, because in order for teenagers to get the pleasure, they need to do something really exciting, really risky, really test limiting, because they need to have that shoot of dopamine. That's why whenever they get a good feed, whenever they get a good comment, whenever they get another friend request, whenever they found some celebrity is in there following them, I mean that dopamine rush get so high, and they want to they want to get that pleasure over and over again, and that's why their brain they are spending so much time. And the third factor in teenage brain is that their prefrontal cortex, which we call it a thinking brain, is not as much developed as the adult. That's why their power of their the decision of that this is 10 p.m. or 11 p.m. and if I use more social media, it will affect my sleep, it will affect my next day school performance. Those rationalization, sound judgment is not there yet. So that's why, because of all these factors, these teenage brain, they are more vulnerable. And now you can imagine during the COVID. So we know that teenage brain, they are trying to identify, they are exploring their identity, they try to test limit, but schools were closed for the past 1 year or so. There are the malls were closed, outdoor dining were not there, hanging out were not there, birthday parties, social events, sports, all those things were not there. So where these teenagers were getting the validation, where, I mean, definitely as I said, that because of the wanting to get more independence, they're not getting this this identity formation by talking more to parents. So where they are getting more validation and where they are exploring to see what is out there, what I need to wear, how I need to talk, is through social media. That's why during COVID, that the social media got so excessive, because of there are no other channels where they can have that player response or have that validation or have that the fun time. And the tricky part is, if as a parent we don't provide a sportive environment, very hard to do, when your teenager is trying to test your limits, trying to do risky behavior, and seem like spending more time on the social media. It's very hard as a parent to be more sportive, to be more open, to be more non-judgmental, and not get into tussle. And that's why many times we see these teenagers, they are going into role confusion, there is self-doubting. They try to understand, is there any meaning of my life, or what is I'm doing? So this is a very funny, that in teenager brain, what in teenager brain is going on social media, what to wear, what to do, and the parental advice is usually, is just going through one ear and just coming out through another ear. And the other, so teenage brain vulnerable. And the other thing which I also mention is, during non-COVID era, when teenagers were depressed, sad, they were talking to their friends, they were having, maybe going out and, trying to cope. But now lately, what has been happening, that teenagers, even adults, we can see, I'm not just blaming on teenagers, even an adult who are using social media as a coping mechanism. For example, a teenager did a bad evaluation in the high school, came home, very hesitant to tell parents, because of being, yelled at, or maybe told parents, but parents got mad. So so she or they found out, okay, let me go to my social media, and start looking into different posts, and just forget that pain. And then what happened is, there is a really good phrase in neuroscience, that neurons that wires together, which mean that that if you are sad, if you're upset, and you start using social media, and you start feeling happy, or you start feeling that sadness moment, so that sadness and social media, so both neurons, because they fires together so many times, know they are wired together, which means the next time when the teenage will get sad, they will automatically go to the social media use. And so teenage brain is vulnerable. And the second part is that they are using it as a coping. And the third, which is, we call it a brain hacking, which, the social media industry, they are spending millions of dollars to make sure, they realize what your trends are, what you are interested in. And they are, shaping our thoughts and feelings and action to get me and our family to feel need to check in constantly. And many of us, including teenager and even adult, sometimes the first thing that we look in the morning is our phone. So we talk about why teenage is vulnerable, their neurodevelopment, their coping, the way they are using, and then this brain, the market that has been investing so much money. So now let's talk about what are the different challenges or impact of social media on teenage brain. So these are a couple of studies on Instagram, because that is very popular, in teenagers. TikTok is pretty, popular. So Instagram, what they are saying is that this source of teenage girls worsening body image issues in 1/3 of the girl, worsening of self-perception among 14% of the boys, suicidal thinking among 13% of British users and 6% of American users. And this is not the new finding. Even in 2017, the Royal Society of Public Health, UK, they did the similar study, and they found out the Instagram, especially because there are so much visual, the small videos, the pictures, that one of the worst ranking in respect of the impact on health and well-being. What are the other impact? Sleep quality, higher level of anxiety and depression, body image, as I mentioned, less satisfaction with their life. It's very interesting. A lot of time people may think, when they are feeling sad, when they are feeling down, and looking into something, that is making them feeling not sad. So maybe they are more satisfied, but what the research is showing is they are less satisfied because they are so much unrealistic expectation about self and the world around them. Because you can see what we post on social media. We post on social media the best part of our life. When the kids are having fun, when we are on vacation, when we are on dining out, no one posts the mess or the fights or the yelling or the screaming that is happening on daily during the breakfast, during lunch, during dining table, at the bedtime. No one shared those stories. It's all about happiness. It's all about the kind of the perfect word. So all the weekend, if things are going really bad, but things that got posted is the best part of that weekend, and that may be just for a few seconds. And then it is also causing social isolation from friends and families, recurrent anger outbursts, and this fear of missing out. That's that is another common phenomena that is happening in teenagers. And this is Yik Yak, some of you may know. So this is anonymous discussion app group. It was shut down in 2017. So basically what this app does is that it connects you within I think a certain radius. So it was very popular app in the college setting. And what happened, there were numerous reports of cyber harassment, threats of physical and sexual violence, bomb threats, to the point that the school had to lock down, criminal charges related to making threats of violence against Black students. And this app is back. I think since August 16th, this app is back with the new owner. And again, not much what has changed, what kind of the measure they have taken to avoid what have done in the past. So let's talk about what parents can do. We talk about why the teenagers are vulnerable, who talked about how it can affect. So let's talk about what the parents can do. Many times, when parents come to my clinic, they said, Dr. Saab, I have tried everything. But you have tried, I have taken away the phone, I have turn off the Wi-Fi at a certain amount of time, I have restrict their privileges. But then I asked, but what alternate have you offered them? Oh, I have offered them to to read more books. I said, books are so boring that even I feel bored. A lot of people, they found it boring. How can you imagine a teenage brain which has a vulnerability of to be bored because of the dopamine level? How can you imagine or make sense that taking away the phone or the devices that are giving so happy pleasure and then replacing it with some activities that are boring? So we need to be more creative, in creating some offline activities. Those activities could be inviting your your teenager friends over at the house. It will make mess for sure, but definitely it's worth it, where you can rather than spending hours on social media, at least you can encourage them. It will be fun for them. It will also build connection between you and your teenagers. Family dining out, going to shopping may cost definitely money, but I'm not talking about going excessive shopping, but some activities, going to the mall, movie time, engaging in some volunteer activities in the community. And then this is what we call it a Formulate family media plan. I think American Academy of Pediatrics, they have they have some resources on it. And so what is this plan is basically consist of? So what happening is, as I mentioned, the teenager, they are experimenting their more autonomy. And when the parents, they try to more controlling, that's where the things get problematic. So with this media plan, we will ask teenagers, okay, how many hours would you like to use social media? Okay, they may say 10 hours. Definitely, we will help them understand, okay, if you use 10 hours, then it it will affect your sleep, it will affect your meal time, it will affect your school performance, it will affect your grades. So then so first we get some realistic, okay, they say maybe 3-4 hours. And then we ask parents, what are their expectations? Most of the time parents say no more than 30-minute media time, and I want to make sure this child, my teenager, eat, sleep okay, have some spend time with the family, do good grades. So what we help parents understand, as long as a teenager is, eating, sleeping an adequate amount of sleep, doing his homework, her, or I want to be mindful about the pronoun, their homework, and have some family and some activity, whatever the time is left, it's okay to allow the teenager to be more autonomous in using the the social media. Yes, there need to be limits, like maybe 9 p.m., 10 p.m., the Wi-Fi and those things, whatever the limits you want to set, they can earn more on the weekend. But there need to be feel of more autonomy, that as a parent, I'm trying to understand, I'm trying to help my teen, I'm trying to connect with my teenager brain, that yes, my teenager want to get this validation, want to explore the identity, and want to feel more connected, and that's why the teenager need to use the social media to connect. But I'm also helping, because remember, their teenage, the prefrontal cortex is not developed. So I, as a parent, also helping them, but make sure you are sleeping, you are eating, you're finishing your homework, and you have some social activities. I will end my presentation with this slide, because many times, the issue happen and parents came, and whenever there is a disconnect, or whenever there is a disagreement, whenever the parents find out, you set some limits and the teenager violate the limits. So what they can do, what are different steps? Usually, for example, let's take an example. So, the time was, so the coming home time was 9 p.m. and teenager is coming around 11 p.m. And many times what is happening is, the moment the teenager walk into the house, either the parents, they may get mad, tell, or God forbid, if the teenager got involved in some bad, bad behavior, or involved in some, in some problem. So the moment they come home, we start telling, remember I told you not to go home, remember I told you not to go out after this time, not to hang out with these friends, remember how many times you were got into trouble, why not you do this thing next time? So we just jump on trying to fix the behavior. So today, what I would like to end and give this message, that we need to, as a parent, we need to not get rid, but take a slow pace of this problem fixing mind to connecting mind, and let me go through step by step. So first step is, whenever there is a disagreement, or whenever there is a violation, of the limits, or whenever there is a failure, or whenever there is an anger, or whenever there is a misbehavior from a teenager, so instead of try to fix it, instead of try to to control it, instead of try to memorize the try to name all those bad things the teenager have done in the past, the first step, I will encourage parents to stay calm. Because what the science is showing is, whenever the more you stay calm, the better you are able to help the other teenager. For example, if a husband and wives are fighting, and if a husband is talking loudly, angry, although he may be at fault, but if the wife is also start talking loudly and try to tell the husband how many wrong things that he has done in the past, his family has done, so things may get worse. But if the one partner will stay calm, understanding, even though the fault is for another person, the understanding, the more I stay calm, the better I can help the other person. So the same thing, as a parent, we need to act as a bridge to calmness to our teenagers, our children. So first step is stay calm, very hard to do, but very practical. And the second thing, we need to validate the feeling, rather than telling why you did it and all those bad things. We have to say these things, that you seem angry, you seem mad, you seem upset, you seem sad. Because what the neuroscience is saying is, name it to tame it. Naming to taming, meaning that if you can help a teenager to name that feeling, you can help the teenager brain to tame it. And you are also building the connection. The teenager brain is used to doing bad thing, getting yelled, getting screamed, but no, you are staying calm, you are trying to validate the feeling, and then collaboratively explore what's going on, what happened, how did you get delayed, and then try to come up with some solution. Okay, why not next time, let's do things differently. If you are getting late, why not if you can text me, or some strategy. And the final step is that reflect that in the past, what I have done that was helpful, and and how to make things differently. So again, as a parent, we need to really act as a bridge to calmness to our teenagers. If we act as a bridge, that will help them not to explore their identity by getting validation from outside, getting validation from the social media, getting this recognition or feeling happy or using social media as a coping mechanism. Because so if we can provide the bridge to calmness, if you can provide that validation, if you can work on connecting with our teenagers, what is happening in my teenager brain, that will really help our teenager to be more open, to more willing to share what has been going on. And if the teenager mess up, he or she or they are more open to discuss, and get your wisdom and advice. Thank you.
Thank you so much, Dr. Zishan. That was a very highly relevant talk this afternoon. I enjoyed it thoroughly. I have a teenager. Most of us, I believe, in attendance today as audience and viewers, we are first generation social media users. So we are all kind of relating to words as you were saying that. And most of us have teenagers or adolescents, either in our families or if not so, then in our practices for sure. So all of this is actually very, very relevant. So thank you so much. And I completely agree. It's kind of an interaction or a chemistry between parents and understanding their teenagers. And most of parents, I would say, from South Asian backgrounds, they don't really understand that chemistry much, and they try to take that power or autonomy in their hands and control their teenagers, which eventually does not really work out really well. So thank you so much for touching base on those pieces. There are a few questions, but unfortunately, because of time constraints, I am just going to put out just one question to you. As you have, literally, alluded a lot of questions to in your presentation already. One question is about, are there any online resources that can provide parents with tools to kind of understand these complex situations much better and equip themselves to be, better able to help their teenager or adolescent, children?
Yes, so I have shared this website. It has, this is commonsensemedia.org. This is a really good website. It has so many resources for parents. It has so many resources. What are the new video games are there? What are different apps? How can parents bring that conversation? So that I highly recommend. And I got trained at Boston Children's. So at Boston Children, we have this called Clinic for Interactive Social Media Use Disorder. So sim8.org. And if you go to that website, click Media Lab. Sorry, it's just a typo. It's a Media Lab. And you will see Dr. Mike Rich, I believe. And he called himself as a mediatician. I mean, he has so many podcasts, so many blogs, a lot of practical tips for parents. Then American Academy of Pediatrics have some good resources, including the Family Media Plan that we can implement. And then American Academy of Child and Adolescent Psychiatry, they also have really good resources for parents, clinicians, and teachers as well.
Great, thank you so much. And I see, Dr. Zishan, that you have put your email out there as well. So I would definitely ask viewers to email you directly for any questions if they have, since I see that there is a lot of interest that has been generated from your presentation. But unfortunately, because we are running behind a little bit, I will have to end this conversation here. Thank you really, once again, for a very great presentation that very well fits into the format of this afternoon, I would say. Thank you for joining us this morning.
Thank you for having me.
All right, so we are almost at the end of our program. I am significantly overwhelmed by the wealth of information that has poured in this afternoon. Very informative, very engaging talks. I would like to thank our esteemed speakers once again for joining us today and sharing their expertise with all of us. there was an overwhelming response today and a lot of questions poured in. Unfortunately, because of time constraints, we were not able to accommodate all of them, but please feel free to note down the email addresses of the speakers that has been shared in the chat box. And please feel free to directly contact the guest speakers for the answers. Before we end today's wonderful session, I would like to kindly invite Dr. Mukarram Ali Zaidi to please say a few words. Dr. Zaidi is an experienced family physician in Calgary, Alberta, and a public health expert. He is also the founder and chairman of Think for Actions, which is a nonprofit organization focusing on empowering youth and supporting them in their professional development. Please join me in welcoming Dr. Mukarram Ali Zaidi.
Thank you, Samina, and our esteemed experts. This was really an informative and engaging program with much needed information that we needed. First of all, I'd like to thank you of the Alberta chapter and all the board members for their support to get us over here. And then the planning committee that includes Dr. Saad Yassin, Dr. Tariq Awan, Dr. Abdul Qadir Kamran, Dr. Amir Aslam, Dr. Ashfaq Shoaib, Dr. Khurshid Khan, Dr. Laik Siddiqui, Dr. Muzaffar Siddiqui, Dr. Samina Ashraf Bajwa, Dr. Samina Noor, Dr. Yasmin Majid. And with those, we really are getting the benefit of Dr. Tariq Awan's exceptional leadership with Alberta chapter. So the way he has brought this chapter forward and it's working effectively. But I would also like to thank Dr. Rizwan Khalid, Apna President, our two MCs, Dr. Samina Noor and Dr. Muzaffar Siddiqui. They did all the legwork behind the scene with the rest of the committee. But this program flowed really well. It was easy to engage and understand. It was engaging as well. And I would really like to thank our panelists, Dr. Muhammad Zishan and Dr. Asfar Chak. Thank you very much for taking your time, preparing the presentation and kind of blessing us with your presence and knowledge. I think these are the questions that parents and a common person have at this point. And I think you answer most of our questions. At the same time, I would also like to thank Dr. Jennifer Jasper from Mayfair for their support to Alberta chapter. And with that, back to you, Samina. Thank you very much.
Thank you, Dr. Zaidi, for your kind words and concluding remarks that really summarize the thoughts that all of us share in terms of our expression of thanks for our esteemed speakers, as well as our committed sponsor. I'd like to then convey my thanks also to all those in the audience who have graced us with their presence and been instrumental in allowing us to share and disseminate information. I'm going to end with an anecdote that I first shared last year as we were experiencing the initial throes of the pandemic, not merely because it is as relevant now as it was then, but because in retrospect, it came to haunt me that I had misquoted the source. The reference was due to the great boxing legend and social critic and philanthropist and patient of Parkinson's disease, Muhammad Ali, who was asked at one of his addresses, I think at Harvard University, for a poem, given that he was renowned actually for his spontaneous quips. Now in the twilight of his years and his careers, he still didn't manage to make a gesture, a triumphalist gesture, raise his hand in the air, and as recounted by sports writer George Plimpton, not Norman Mailer, as I suggested last year incorrectly, he was reported to have simply looked at the audience and said, "Me, we." Now, George Plimpton wrote, actually, the editors of the Dictionary of English Proverbs, Idioms, and Poetry, and indicated that according to their reference, the shortest poem in the English language, perhaps also relevant to our discussion on COVID, is a poem simply entitled "On the Antiquity of Microbes." And the poem simply reads, Adam had 'em. Well, George Plimpton wrote the dictionary and said, you know what? Now you look here. Me, we is shorter than Adam had 'em. And indeed, perhaps resounds much more inspiringly, in a much more inspired fashion rather, on really summarizing the attitude of collaboration and mutual support that we're going to have to continue to foster in the days ahead. Thank you all for joining us.